How's it going, guys? We have a pass level question for MSK anatomy. Step one, just got to check off the box in this stuff. Be a short clip here. So you got a dude who has a radial nerve injury, which is obviously the case when you have failure of extension of the wrist, a wrist drop, okay, and also inability to extend the fingers. And we just want to know what's injured. Hook of hamate fracture, wrong fucking answer. That's ulnar nerve injury at the wrist. Causes Guyan canal syndrome. This can occur with handlebar impaction. So cyclists can occur with push-ups. Okay, people who do push-ups, they can get impingement of the ulnar nerve at the hamate, and that can cause numbness of the fourth and fifth fingers. Okay, so that's hook of hamate fracture. And in addition to the ulnar nerve innervating and allowing for flexion of the fourth and fifth fingers, the ring finger and pinky, you need to know that ulnar nerve injury at the wrist can cause positive froment sign, F-R-O-M-E-N-T, which is inability to adduct the thumb, which is holding a piece of paper between the thumb and the index finger. Sounds very weird because you say, but wait a second, the thumb is on the lateral aspect of the wrist, the radial aspect of the wrist. Shouldn't that be median nerve? It's not. So thumb opposition, where you contact your thumb to your pinky, yes, that's median nerve, but thumb adduction, holy shit, where it's contacting the index finger, that's ulnar nerve. Okay, and they'll tell you that the patient has an inability to hold a piece of paper between the thumb and the index finger without flexing the index finger. That's a positive froment sign. The patient cannot thumb adduct. That's ulnar nerve injury, not median nerve injury. And also inability to adduct and abduct the other fingers, the interosseous muscles, pad, dab, that's ulnar nerve injury as well. Wrong fucking answer. Choice B, medial epicondylar fracture, wrong fucking answer. Ulnar nerve injury at the elbow can cause not just medial forearm findings, motor sensory, but can also be cubital tunnel syndrome. So cubital tunnel syndrome is going to be numbness, paresthesias of the not only the medial forearm, but also of the fourth and fifth digits. Okay, you don't have to have a fracture for that, but those of you have obviously heard of carpal tunnel syndrome, but holy shit, you need to know cubital tunnel syndrome for USMLE as well, especially 2CK family medicine. Okay, so they give you paresthesias, the fourth and fifth fingers, cubital tunnel syndrome, and they want overnight elbow splint as the answer. Choice B, wrong fucking answer. Choice C, mid-shaft fracture humerus, correct answer. So this is how you injure the radial nerve. And they can say also fracture at the radial groove. Couldn't be more obvious as well, but I've seen that as another NBME answer, even easier. But this is how you get radial nerve injury. And so inability to extend the wrist drop, inability to extend the fingers. So best extensors is a mnemonic for memorizing radial nerve. So brachioradialis, extensors, supinator, triceps, that's radial nerve. So if you can't supinate, you'd be in a pronated position. So they could describe this patient as having a pronated arm with a wrist drop and decreased triceps function. Okay, that's radial nerve injury. So let's just hop through the others here. Supracondylar fracture humerus, wrong fucking answer. This is going to be medial, a median nerve. Okay, so median nerve injury, obviously, this is going to be the most of the muscles of the forearm, lateral aspect of the forearm as well for sensory. Actually, I shouldn't, that's fucking wrong, okay? You need to know the lateral sensation of the forearm is musculocutaneous nerve. I don't have that in terms of an injury. There's no specific injury you need to know for musculocutaneous nerve, but you need to know tangentially. Musculocutaneous nerve is sensation of lateral forearm and biceps function. When we talk about median nerve in general, we're talking about all the muscles of the forearm, including the lateral muscles of the forearm, okay? Whereas the ulnar nerve is just the medial aspect of the forearm for motor function, okay? So carpal tunnel syndrome, obviously, if you had median nerve entrapment at the level of the wrist, and I already talked about that, median nerve is going to do thumb opposition, not thumb adduction, and also flexion of the first 3.5 digits, technically. So finalized surgical neck humerus, wrong fucking answer. Auxiliary axillary nerve. So they can just tell you that you have decreased abduction ability of the deltoid. and they'll also say lack of sensation over the shoulder, the lateral shoulder. It's not hard, okay? Don't confuse with when you have a supraspinatus injury, okay, for the rotator cuff, that you can have decreased ability to abduct the shoulder the first 30 degrees. That's buzzy. I don't want to get into a huge side discussion right now about that, because there is one question on one of the 2CK forms where they actually tell you the patient can't abduct in a greater range of motion than just 30 degrees, and it's still supraspinatus. But we talk about like 14 out of 15 questions. First 30 degrees is supraspinatus, and then after the first 30 degrees, that's when the deltoid takes over. Okay, and deltoid is axillary nerve. It's what they want you to know for USMLE. Choice E, wrong fucking answer. You know the deal. To make more content, if you like my stuff, screen. Appreciate your time. That's it.